Thanks everybody for being here. Welcome to this webinar. Pinnacle Health Informatics is doing these webinars monthly, and we decided to start a new set of webinars where we're going to be going over these tools we're designing to help people with developing reports that would be useful to them. Some of the common requests that we get for reports that we know people are out there working on, and we're trying to develop some sort of universal tools that people could use to help translate their clinical or operational needs into data or reporting needs.
This is Sean, by the way. Welcome, everybody.
Welcome. This is Gary.
And and I should have said who I am. This is Ginger Van Dien. I'm the Director of Clinical Data and Analytics at Pinnacle Health Informatics. So welcome. And as I said, we're trying to work on some universal tools that people can use when they're designing reports. And an important report type that we've run across a lot lately has to do with developing a proactive approach to improving compliance and quality. So this tool that we're going to talk about today is designed to help address that problem. So our agenda for today's webinar is, first, we're going to discuss some of the benefits of proactive reporting for clinicians and managers. We're going to review the quality and compliance report worksheet that we've developed here at Pinnacle. We're going to complete an example section of the worksheet from the perspective of a clinician and a report builder, and then we'll have time in the middle and at the end for audience questions and comments. So first, I just wanted to talk a little bit about the benefits of proactive reporting. A lot of agencies in our current age are thinking about compliance and monitoring and auditing, and a lot of folks have compliance programs or quality assurance programs where they look at their documentation and review charts and look for issues. And a lot of that is done in what I would think of as, or maybe call a reactive or a retrospective auditing approach, where agencies are looking back at documentation to see where they might have issues and then trying to address those. And that often leads to things like paybacks, because those errors have already happened and services have been billed for, and so things where errors need to get repaid back to the payers. And so a proactive or prospective reporting process allows you to identify errors while they can still be corrected. And so a lot of agencies are moving to that approach where they try to get out ahead of things that are coming due, try to get things taken care of before a service has happened and has been billed for that they are going to need to repay. So some of the other benefits of a proactive approach, sometimes a retrospective auditing approach can be perceived by staff as unpredictable because they don't know what's coming due until it's already late or they've already made a mistake. Or sometimes that can even come across as kind of punitive. And I think about this a lot with the move toward trauma-informed care and how we're trying to have trauma-informed cultures within our agencies, and how a big part of that is having processes in place that make things predictable and knowable, and so people aren't having sort of gotcha moments where they feel like they didn't know what they were supposed to do until they already made a mistake. So a more proactive approach to reporting provides staff and managers with time to predict and plan ahead so that they can have a more structured set of things they know they need to do every day. The other thing that having kind of a reactive or looking back auditing approach can do is that if there are program requirements that haven't been identified, they just get missed completely. Whereas if you're doing things proactively, you can notice right away, you can identify the things that need to get done and build them into your system so that you don't have those things getting lost in the shuffle. The other thing is, of course, just like we know about change with people, that changing behaviors can be hard. Forming habits is easy, and changing them is even harder. Is hard. So sometimes it's helpful to help find patterns early on so that you can help people develop positive habits versus challenging habits that are going to be difficult to change over time. And then I think the other thing is at a macro level that if you only know about problems after they've happened, you don't have an opportunity to devote additional training or resources to those areas where you've got issues. Whereas if you're out ahead of things, you can visualize things that are going on and identify gaps or challenges that you need to devote extra resources or training to. So those are some of the benefits of getting out ahead of things versus looking backward. And of course, then there's the overall issue or the overall benefit, which is hopefully if you're out ahead of things, there are fewer things you need to pay back, and that helps your agency's financial health. So as I said, we've developed a standard, sort of a universal tool that we hope could be useful to people as they are working on these types of projects where they're trying to kind of define what the requirements are for for their documentation compliance or quality. And so I'm going to go through that tool for a minute. I'll do a quick intro to that tool, and then I'll have a moment where people can jump in with questions. So let me just pull up this tool here. And I should have mentioned that we're going to go ahead and email this. Well, we'll have this tool out on our website, so you can go out and download it, or please feel free also to email me if you would like a copy. This is just something we made for you guys to use. And please put something in the chat window if this isn't zoomed in. There's also a way to zoom in on your GoToMeeting, so feel free to do that if you're having trouble seeing the screen. I'll try to zoom in a little more even here. Oops, that's not in, that's out. Okay. So basically, we've designed this tool, and like I said, it'll be available to everyone. And what we have here is for, we know that there are different requirements for different programs. And so what we did is we made 7 different program spots here, but you could certainly copy the sheet and make additional programs. And the way this is designed is that for each program, you would go through these categories, and with a clinical staff and hopefully also maybe a technical person, you would define what's required for each of these parts of the documentation and how those parts are then tracked within your electronic health record. So we've divided this out into what we thought were kind of general, universal sort of phases of treatment or phases of documentation. So we've got access and screening, entry or admission, assessment diagnosis, treatment or service plan, service delivery, assessment, diagnostic reviews or updates, treatment service plan reviews or updates, and then discharge. And then for each of these sections, what we've got is we've got these different columns that go through what might be required. So for example, if you have 3 different types of documentation that are required as part of your access and screening, there's a spot for each of those. And of course, you could copy the rows and make additional items in here too. If you need any help with that, you could reach out to us and we could help you. But anyway, the way this is designed is that the first thing you could do for each of these is to ask the clinician or the operations person to talk about what it needs to be gathered or documented. And then for each of those questions, there's more detailed questions that you can use in combination with your technical people and clinical people to figure out how that's actually defined in your electronic health record. And so there's the information that needs to be gathered or documented, and then there's what has to be complete in that documentation, and then there's when does it need to be completed, and then there's who needs to sign it, and then there's when does it need to be signed, and then finally some more general questions about who's responsible for taking care of that and how far in advance is it helpful to know if there's an issue. And then sorry, I skipped ahead. I meant to also say back here, then the sort of technical side of those questions is where can you see how can you figure out in your electronic health record the person who's responsible for that requirement, and then where in the electronic health record would it be helpful to see that information. And so basically this tool is designed to help sort of facilitate the conversation that can happen between clinical staff, operations staff, and more technical staff to help develop a report that you could use to get out ahead of some of these requirements. We've been doing some of these kinds of reports at Pinnacle, and we've just noticed that sometimes it's easier to have kind of a structure as you try to organize your thoughts around this. And so that's why we've provided this this tool. And so I'm going to open things up for questions and comments for a minute here, and then I'm going to actually go through kind of an example of filling out one of these sections and sort of explaining what some of the questions mean. Just so you know, also in this tool, we have an example program where I've actually kind of made up an example program and filled out all the sections too, and you'll have access to that within this tool. So, but today we're going to also go in and fill out one of these sections. I think we're going to do an assessment diagnosis, and I'll kind of walk through how that conversation could go with the clinician. But first, I wanted to give people an opportunity to ask questions. So, what questions or comments do you guys have so far about this?
This is Sean, by the way. I think this is a great tool, Ginger, that you prepared for this call, and it really will help if an agency wants to undertake this kind of a project. I just think that this is a great way to organize the requirements and specifications. So I think it's a very useful tool.
Thanks, Sean. And I should have mentioned that our plan at Pinnacle is to do a similar tool for several other categories of reports. So I'm going to go over that at the end of the webinar, but that's coming. So we started with this one, but we're going to be building this out for different types of reports too. So feedback about the format and things like that would be helpful too. Any other thoughts or questions before I dive in? Okay, so just for today's example, I'm going to go ahead and fill out, I think a pretty universal documentation requirement throughout our different organizations is having some kind of assessment or diagnostic tool that folks use across most programs. I think that's pretty universal. And I should have said, some of these may not apply at all to some of your programs, right? I mean, some programs never discharge people. Some programs don't use a treatment plan. Some programs don't use an assessment. We really designed this not that you would fill out every section, but that you would use it as a tool to figure out what sections do apply. So if I was having a conversation, so for those of you who don't know, I'm actually a person who has a clinical background. So I'm a licensed social worker, and then I also have taught myself a lot of technical things. So what I'm going to try to do here, and we'll see how it goes, I'm going to try to kind of pretend from my clinical side how I might say things as a clinician, and then how I might help a clinician narrow that down into more technical thoughts. So we're going to try this out. I'll try wearing my clinical hat and then my sort of technical hat. Okay, so if I were to ask a clinician what type of information needs to be gathered or documented for your assessment, what has to be documented, they would probably just say something like an assessment. Okay, an assessment. And then if I said, is there anything else besides an assessment that needs to be done around diagnosis, they might say like an assessment, and maybe they'd say an assessment, a clinical formulation. Oops, I spelled formulation wrong. Formulation and a diagnosis. Maybe they would say that. Okay, let me just make this a little bigger so you guys can see. Let me get that wrapped in. Well, okay. Okay, so the next question I would ask as from more of a technical side is what document or documents are used to record that information in the EHR? And so then they might just say like, well, the assessment form, and then they might say the diagnosis screen. Okay, and what are the specific names for that? So this is a step that often gets missed, I've noticed, is often there's a term that clinicians are using to describe a form or that the agency uses to describe a form, but it might not be the actual name of that form in the electronic health record. So perhaps the actual name for that form in the electronic health record is something like mental health assessment. And when you go to the step of actually writing a report, it's really helpful to know the actual name of that report, as people who have written reports would probably tell you. And I'm just going to fix this wrapping really quick because it's going to drive me crazy. There we go. Okay. So then they might say, well, it's the mental health assessment. And then let's say in some EHRs, the diagnosis is actually still in a screen called Access Summary. So let's just put that, make it a little trickier. And of course, now it's not doing the wrapping I want. I wanted to wrap. Sorry, guys. Okay. All right. So so then this is the other question that is often forgotten or missed is what are the names of previous documents that were used for the same documentation in the EHR? So a lot of times people have gone through various versions of a form, so it can be really helpful to at least ask that question, right? Like, oh, well, it used to be called the intake assessment. So that's really helpful to know. And then I have this question in there because does the electronic health record have a built-in hard stop mechanism that takes care of this requirement? It's really helpful to at least ask that question. Like, for example, some EHRs, you can't bill for service if there is no diagnosis entered. So really there's kind of a hard stop for the diagnosis, but there's no hard stop making sure there's an assessment. Other EHRs do have hard stops. So it's good to ask that question because if the EHR is already doing that work for you, maybe you don't need that built into a report. So we'll say for this one, it's not. Okay. So what must be completed for the documentation to be considered complete? Are there exceptions? And so this is where it's helpful to know what parts of the documentation are really important. So then the clinician might say, well, there should at least be the presenting problem the clinical formulation, let's say the presenting problem, the psychiatric history, and the clinical formulation. Okay. And then, oh, and then also there's a good important question here. Are there exceptions? So are there sometimes exceptions? So maybe except for the crisis program. Maybe you don't require that. Okay. What are those required elements or sections named in the EHR? So again, this is where often the difficulty in defining report requirements is that a clinician or an operations person will use a certain word or a certain terminology, but it actually doesn't mean the same thing as what it's called in the EHR. So here we might call, maybe it's actually called mental health history instead of psychiatric history, etc. Okay. What type of information needs to be present in each EHR element for the documentation to be considered complete? Well, this is where you can sometimes find out, like, well, actually, as long as they put something in the box, even if what they put in the box is NA, that's fine. Or maybe, no, they shouldn't be putting NA, they shouldn't be putting none. So maybe you want to say at least 5 characters need to be present, let's say. Because that would be more, or at least 6 characters. So that's, if they typed NONE period, that would kind of flag you. Okay, where can you look in the EHR for the event or information that would make an exception to the sections that must be completed? Okay, so this would be, how do you know someone's active in the, when it says except for the crisis program, how do you know what they mean by crisis program? So do they mean if they're open in the crisis program? Do they mean if the service is being provided in the crisis program? So those are important things to determine in order to write this report. So we'll say for this person, need to only for assessments being completed in the crisis program. Okay, so then when does the documentation, oh, I might have just messed up my screen here. Hold on, sorry about that. Okay, so when does the documentation need to be completed? Is that based on another event? Okay, so for an assessment, a lot of agencies have a rule that the assessment has to be completed before any other services are provided, and it needs to be the first service provided. So, so then it's important to figure out what do they mean by first service. But usually a clinician would say something like right away. It needs to be completed right away, like first thing before any other services. Okay, and then where can you look in the EHR for the event that would be used to calculate the deadline? So that helps people think about, okay, well, what I mean is you would look at the program admission date, let's say, and look for the first service, the date of the first service, and that date is when the assessment must be completed. Let's see, that for the date of the first service after that admission date. Okay, and then where can you look for an event or information that would change the deadline? So this is where it's helpful to say any service or certain services certain services don't count. So maybe don't count note to chart services, or maybe don't count crisis services, for example. Okay, then does a document need to be signed by a person with a specific credential or relationship to the client? So perhaps it needs to be signed by someone, by their primary clinician, or perhaps it needs to be signed by a person with a certain credential. So let's say in this situation, the clinician would say by the provider of the service, who should be at least a master's level clinician. And then where can you look in the EHR for who that would be? You would look at the provider of the service, check that credentials are MSW, MA, etc. Okay, and then where can you look for information that would change who needs to sign the document? So this is where people often, it's easy to forget, right? Like there might be exceptions, like, oh yeah, I guess an MD could sign it too if they were doing an assessment, or if a person's meds only, they don't need one of these assessments, then they get their assessment from the MD. So those are just some things to think about, like MD assessments, etc. Okay. Does the document need to be signed by a certain date? So do you have a certain deadline that that needs to be signed by? And is that based on another event, like signed? Let's say this one is signed within 72 hours of the service. All right, where can you look for the event that would be used to calculate that deadline? So look at the date of service. Where can you look for an event that would change that deadline? Let's see, can we think of any exceptions? So maybe it's business days, right? So, okay, which staff are responsible for completing this requirement? So this is more generally like who's responsible for making sure this gets done. And so let's say for an assessment, it's the primary provider, and any other treatment providers would need to know that it's missing. Okay, how far in advance is it helpful to know it's coming due? Well, since this is due right at the date of service, like they need to know right away. They need to know before any other services are provided, right? And where can you look to see who should be informed? Okay, so this is where it's helpful to define what do you mean by primary provider, or what do you mean by a treatment provider? So maybe in this case you mean the staff person assigned as primary on the team. And then maybe by other treatment providers, maybe that means any master's level, because you really want your case managers to also see that. So maybe there's certain staff you want informed of that, equals any other therapists, let's say. All right, and is there a logical place in the EHR workflow where this information can be displayed? So this is where it's helpful to think about, is this information that you'd want to see on your schedule for the day? Like you'd want to know, of the people coming in today, is someone missing their assessment? And or do you want to see, this is everyone on my caseload and this is who's missing their assessment? So that's just, you know, where do people want to see that? So we would say on their schedule, or related to their schedule and caseload, let's say. Okay. And so you see, this is just for that initial assessment. There's another section where you go over like, when is it due annually? And the difference might be then, especially at those last sections where it's asking, when would it be helpful to know? That's where it's helpful to think about, okay, it'd be helpful to know 30 days in advance, or it'd be helpful to know 60 days in advance, or for certain staff, it'd be helpful to know 90 days in advance. Okay. So that's kind of a walkthrough of how this document's designed to be used. After going through it like that, what questions do people have? What comments do you guys have?
You know, Ginger, I think this is a fantastic tool because we've had so many requests for this type of report. Virtually every one of our clients are asking for something like this at the present time, or we've delivered something in the past to them. You know, earlier on, we used to use just a bunch of QA reports, but a targeted BI application such as this, you know, a dashboard that everybody has access to, can really change the way a company does business.
Thanks, Gary. Yeah, I think it can also really change things for clinicians or for their supervisors. So I always felt like, as a clinician, it's not really fair to say people are behind on their documentation if you're not giving them a way to know what's coming due so that they can stay on top of it. Like, it's just not really very fair, you know. How you know, and I know a lot of clinicians in the interim build spreadsheets for themselves. I've known a lot of clinicians who just decided to make themselves a spreadsheet so they could keep track of when things were coming due. But of course, that's not a perfect system.
Right.
Hi, this is Fina from Bancroft. I also think this is a really great tool. One of the things we've been working in internally here at Bancroft is designing some dashboards that have, you know, provide relative, you know, good information for our clinicians so that they can be more proactive than reactive. And, you know, one of the things that we see that we run into is that there's some key pieces of the workflow or information that are still not in the system. So we have to like go through the process of identifying what that is, building it into the system, putting it into the workflow, and then eventually getting it onto the dashboard, which is, you know, a process in and of itself. But this is a nice tool to really step through that process and kind of organize the flow of information from one team to another. So this is exactly where we're trying to move towards, but we're still kind of in the very early stages of kind of putting it all together. We have like separate building blocks, but we haven't tied it all together to be able to have a really useful, informative dashboard for our clinicians. So this is great.
Oh, thank you. That makes me think, though, that's a good point, that maybe it would be good to have a question on there about are there maybe even just one column somewhere that says, are there any pieces of this information that are being captured outside of the EHR? Because it sounds like there might be, in some agencies, some parts are still getting done on paper or in other systems. So maybe, I sort of built this thinking about the EHR, but that's a good point that there might be things outside of the EHR. So maybe even a question at the end, like what would need to be brought into the EHR in order to make this tracking possible?
And that's what we run into, is that we still have, like, depending on the program, there are some programs that have more of their documentation in the EHR, and then others that have it outside the EHR. So I don't know if we're just unique that way and we're a little bit behind, or if if other providers are kind of in that same boat. But I think that would help, is like, where does it live if it's not in the EHR?
Mm-hmm. Yeah, that's a really good point. I'll see if I can incorporate that in somehow. That's a great point. Or if it's in a different system, sometimes this involves combining this with like a, for some people, and especially as we get into some of the other types of reports we're going to be looking at, there's other systems that hold part of the data. It may still be an electronic system, but maybe it's held in an agency's HR system, or it's housed in their financial system, and that's where it's helpful to probably, I'll think about how I could incorporate that. That's a really good idea. Other people have questions or thoughts?
This is Danny with Options for Southern Oregon. Where do you see appointments fitting in here? You mentioned like we're behind on recording on our notes. How do we know we're behind if there's, once it's created, then it's there. But I was thinking really the trigger for knowing you're behind is that you saw the client. Mm-hmm. So for ongoing service, does that sort of fall in service delivery, or is that like?
Yeah, I could picture filling that out with that in mind when you would fill out the service delivery. So what needs to be gathered? Well, you need to write a note. When does it need to be completed? Well, it needs to be completed as soon as you've marked an appointment as attended, perhaps. And so then perhaps that's how you would do that. I think maybe another part of your question might be that I'm not sure this tool sort of handles all of the questions you might have about a person's caseload, like have they not seen some of their clients for a really long time, or do they have some clients who are sort of who have had a lot of no-shows? And I think those are some of the future tools we're thinking about developing too. So, but that's a good point, that service delivery documentation gets more, there's a lot more of it usually, and it's more, and I guess knowing that you've gone a long time. So a lot of agencies, like I think kind of what you're alluding to, Danny, a lot of agencies have decided to put some information about the last progress note or the last service provided to folks on the same report where they're capturing this information, because it's kind of all part of the snapshot of a client's case that people like to be able to see for clinicians and supervisors. So, but some of that I kind of was picturing as being sort of in the category of engagement. And so I sort of thought of doing that in sort of a little bit of a separate tool. Did that kind of answer your question,
okay.
Danny?
Sure. Yes. Thank you.
Yeah. So maybe I'll go over that real quick too. Just some of the future tools we're thinking about, since that's kind of a segue. We're going to work on one for routine, urgent, and emergent access, one that's related to engagement and attendance, one related to productivity and utilization of staff time, financial performance, clinical outcomes. Oh, I have financial performance on there twice. I'm sorry. we're really going to work on financial performance, fidelity to evidence-based practices, and then other measurement tools. So that's kind of some of the ideas we've had for other tools. So similarly, just helping people think about, and it may not be in exactly the same format, but designing some tools that will help people kind of organize, okay, what do I need to know to answer the questions I have about productivity? Like, I need to know what services count toward productivity, what services don't count, you know, what counts as a person's available time. You know, a lot of that is specific to different agencies, but the questions are kind of universal. So the answers might be different, but there's similar questions to ask, if that makes sense. So that's some of the stuff we're thinking about for the future.
This is Sean again, just to echo kind of what you said, Ginger. It does seem like we're getting a lot more interest in these sort of projects. And so, you know, we're doing a lot of work in these areas right now. And so, you know, we hope that if we're not currently working with you on something like this, or if there's some interest in doing something like this with us, you know, we'd be happy to chat with you about it, because what these are, I think these are very useful type projects and bring a lot of value.
Yeah, and it's kind of a little bit like it's like what Sean's doing with Power BI and working with some folks on sort of visualizations, and we can use visualizations on top of this, but I think of this as kind of being a little bit more of a granular report that gives you some detail about what's going on out there with your staff and with your documentation. So there's kind of different ways to use data, right? And then this is just kind of using data in a more of a detailed way. But there's no reason that once you've defined all those things, you couldn't build aggregate reports that then show your performance for the whole agency, you know? Like, once you've defined what counts as being done on time or is running late or those kinds of things, it's a lot easier to build aggregate reports that show how are you doing agency-wide on those areas. So we want that data to be meaningful, and so if we make it individualized to the requirements that are specific to the different programs you have, then it means a lot more. Well, thank you all so much for your time today. I really appreciate it. I hope you're recovering from earlier holidays and having fun preparing for future holidays, and staying safe in the snow and all those fun things. And please take care, and we'll talk to you again soon. Thank you all so much.
Thanks, Ginger.
Thank you, guys.
Ginger, thanks everyone for attending.